Hi, my name is Dr. Kimberly Manning. I'm a practicing internist in Atlanta, Georgia. Welcome to ACP's Physician to Physician Conversation Series. This episode is called Uncovering Your Patient's Why. We've all been there, sitting in the clinic or in the hospital, and you're talking to a patient and you ask that question, have you been vaccinated against COVID-19? And the patient says no. And you ask the patient, so have you thought about being vaccinated? And the person sort of gives you a shrug. So the next question becomes, do you mind telling me a little bit more about why you haven't been vaccinated yet? Now, the patient may say a lot of things. The patient may be afraid of needles. It could be logistical. And I think one of the most challenging things we face is when a patient has heard something that may not be true that is guiding their decision to not be vaccinated. So step one is to affirm what the patient has said, right? And then dig a little bit deeper. Tell me more about what you read. Get some specifics. So you have to find a space to allow the patient to talk to you more. And once a patient tells us why they've not been vaccinated, get permission to go further. Would you be okay with me telling you a little bit of information that I've read? Many times the patient will say yes if it's done with kindness. So the real key is to ask the question using living room language and to give your explanation with as little medical jargon as possible. But then pause and actually listen. And what does listening mean? It's our body language. It's what we're doing with our eyes. It's not typing on the computer as the patient is talking. It's centering ourselves on the patient and letting them know through every part of our body that we're in this with you. Now, if the patient mentions something that you aren't clear about, clarify it. So I just want to make sure I understand this correctly. We acknowledge the things that are true, but we also help people put it into a framework because I think we build trust by letting our patients in on the medical knowledge that we have and not underestimating their capacity to understand and process information. Don't bombard the patient with too much information and with medical jargon. Instead, stay specific and on target with the thing that the patient mentioned. So how do we determine what's important to a patient? The fastest way is to ask, to pay attention, and to look at all of the clues around us. Picture this. A patient is sitting across from you. They've come into the clinic to see you and they're still wearing their work uniform. They're letting you know that I have to leave here and go straight to work after this. So you may ask a few questions. Tell me about your job and what you do every day. Finding out what's important to the patient can sometimes happen even before you open your mouth and ask questions. But to get to the real heart of it, ask the patient what their day-to-day life is like. And then ask the patient, what concerns do you have about when you get vaccinated, how that could impact your daily life? So the patient says, well, I heard that when you get the second dose or when you get the booster shot, you feel bad and you may have to call off of work. I'm not in a position to call off of work. What do you suggest about that? Now, the easy thing to do would be to just simply say, oh no, that won't happen. But we do know that people can feel unwell or feel a little run down as their immune system really works hard. And so again, acknowledging those things to our patients, but then adding to that the importance of how protected they will be from future impact of COVID should they get infected is an important place to land with all of that. Our job really is to build trust through trustworthiness. All of it really comes down to empathy, respect, and acknowledging that patient's why. Well, that's all the time we have today. Thank you for watching our series on vaccines. We'd appreciate it if you'd like, subscribe, and click that notification button so you can get information on our future programs.